What's going on, everyone? In this video, we're going to be talking about the Medicare Patient Choice Act, HR 4204, the bill we've been waiting for that would allow PTs to opt out of Medicare and accept cash for physical therapy services from Medicare beneficiaries. So this bill was introduced at the end of June and then referred to the Social Security subcommittee and is currently sitting in subcommittee. And I'll say, unfortunately, doing nothing. Like many other bills out there, it is not on the docket, it's not on the agenda. And our goal is to get it out of the subcommittee. So what we've been doing over the last week or so is having people that live in key districts call their representative because those representatives sit on this subcommittee and asking them to support this bill so that there's more traction and they'll do something about it. So I've been talking with people from Milwaukee and Jacksonville, Florida, and Utah, and all of Connecticut. So thank you so much to all those people that have called. Please continue to keep calling. The trick is since there's only 13 members of this subcommittee, only 13 representatives, we're a little bit limited on what we can do there. So that's why it's so important that you guys keep calling. But for the rest of the country, for the rest of the people, we felt a little stuck. But on July 15th, there was another co-sponsor added to the bill. And that was our light bulb aha moment, where we found out as we're learning about this process that we can add as many co-sponsors as we want, as many co-sponsors as we can get to the bill. And that is what we're going to ask for your guys' help with. That is what we're going to ask for your guys' help with. We're going to ask you guys to call your representative and request them to co-sponsor HR 4204, to co-sponsor the Medicare Patient Choice Act. If you don't know how to, or don't know who your representative is, if you don't know how to find that, we're going to go over right now. So go to house.gov, and it'll look like this. On the top right is going to be find your representative, enter your zip code, and click look up. And you will get this map of your district. And on the left-hand side will be your representative. If your zip code is cut in half by a couple of different districts, it'll ask for your street address before it narrows down who your representative is. From there, you're going to click on their name below their picture, and it will take you to their website. Most websites are going to have a banner across the top with their address, a link to their email, and then their phone number. The 202-225 phone number is going to be for their Washington, D.C. office. Write this down, put it in your phone, whatever you need, because this is the phone number we're going to call. From there, you're going to say this. You're going to read this basically verbatim as a script, and you're going to call, and someone from that office will pick up the phone and say, "Thank you so much for calling Representative McIver's office. How can I help you?" And you'll say, "Hi, my name is Phil Van Pelt. I'm calling to ask Representative McIver to co-sponsor HR 4204, the Medicare Patient Choice Act, which would allow PTs and other qualified providers to opt out of Medicare and accept cash payment for covered physical therapy services. This bill would cut red tape, save Medicare money in the long term, improve access to preventative care, and let patients see providers they trust, helping beneficiaries and small businesses in our community." Done. That's it. From there, they're going to ask you for your name, address, and zip code to confirm that you are a constituent of that representative. Because if you're not a constituent of that representative and can't vote for or against them in the next election, they don't care about your opinion. Once they have that, they will also ask for your email to send you a little follow-up reply email, right? That will be a prefabricated copy paste with the representative's signature at the bottom. All good and dandy there. So once you've called, you're not done, right? I want you to call multiple times. Be persistent. The squeaky wheel gets the oil, and we're trying to be as squeaky as possible here. It's okay to call multiple times in a week. Call once a day. Call 3 to 5 times in a week. That is totally reasonable. There are older adults, retirees across the country who sit in their lazy boys and call their representative basically on the daily about whatever issue they see on TV to make their voice, their opinion known. Even better if you can get 10 to 20 other people to call alongside you, right? So you're going to call multiple times and then try and get as many people as you can to call multiple times as well. Asking ChatGPT and Google, right? What is the minimum effective dose for this? It's somewhere in the ballpark of 10 to 20 people in a short period of time of a few days. So get your neighbors, your family, friends, gym buddies, the people who make your coffee in the morning at the local coffee shop, your patients at the PT clinic, other PTs you work with, basically anybody, to call their representative, even if it's not your own. right? Bonus points if it is your rep, because then we have a concentrated effort and push. But as many people as we can get to call, the better, right? The more people we can get to call, the better. If you have any questions on anything related to this, my phone number is listed here, 908-868-9180. Give me a call, shoot me a text. I'd be more than happy to help you work through it, figure out who your rep is or what to say, anything like that. Call them, call your rep, ask them to sponsor HR 4204. As we're going, right, we will update you guys when we have information, when we know kind of what that next step is, right? So this is our next big push. Keep going, keep calling. Please, thank you so much to everyone who's volunteered and been working so far. We're going to need a whole lot more to get this to the finish line. We will keep you posted. If you have any questions, please feel free to reach out. Thanks, guys.